Governor Ahmadu Umaru Fintiri of Adamawa State has raised concerns over the growing number of children in the state who have not received any form of immunization against preventable diseases. The governor's remarks were delivered by his deputy, Professor Kaletapwa Farauta, at the 2025 First Biannual Meeting of Primary Healthcare with traditional rulers held at the Banquet Hall of the Government House in Yola. Trust TV's Gibson Soadigo reports.
The meeting, convened by the Adamawa State Minister of Health and Human Services, in collaboration with the State Primary Health Care Development Agency, brought together traditional rulers and other stakeholders to discuss ways to strengthen the state's health system, especially the role of royal fathers in advancing health care access in their communities. Commissioner for Health, Chief Felix Tangomi, attributed the state's recent health gains to the strong backing of the Fintiri administration. He pointed to the procurement of CT scan machines and other critical medical infrastructure as evidence to the government's commitment to improving health care system.
The government has been very supportive to ensure that this program succeeds. And the only way we can reciprocate this is to ensure also that we become committed. And that is why we have to hold this meeting. It is not only happening in Adamawa, it happens in every state.
The executive chairman of the State Primary Health Care Development Agency, Dr. Suleiman Saidu Bashir, urged participants to implement the outcomes of the meeting to boost health care access and improve citizen well-being.
Considering the critical role played by our traditional leaders, royal fathers here present, and also leveraging on their structures to see how we project improve the health and well-being of the people of our respective states, Adamawa State.
Governor Fintiri, through his deputy, reiterated the administration's zero-tolerance stance on any lapses that could undermine the health care objectives. He lamented the reoccurrence of vaccine-preventable diseases such as measles, despite routine immunization efforts, and vowed that the government will not relent in addressing the gaps.
Beyond reviewing our immunization campaign and the rising disease burden, we are here to forge a stronger alliance, one that will place traditional institutions at the center of primary healthcare system, strengthening governance and accountability.
Traditional leaders and development partners in attendance pledge continuous support to improve primary health care outcomes and affirm their commitment to achieving universal health coverage in the state. Gibson Soadigo, Trust TV News, Yola.